It is a good morning. This was quite a week. A couple of days ago, we were gathered in this room for the traditional St. Patrick's Day luncheon with President of the United States. It originated with Speaker O'Neill and President Ronald Reagan, and then expanded to include the Taoiseach of Ireland. And we had that event and observed St. Patrick's Day, as all Americans do. Today is the feast of St. Joseph the Worker, particularly significant to Italian Americans. And it's a day where we remember and pray to St. Joseph to benefit the workers of America. And that's exactly what our health care bill will do. I'm very excited about the momentum that is developing around the bill. Some of you present earlier in the week when we started with little children and babies as young as 6 weeks old to talk about what it means to them. Moving on to young people a couple of days ago, to seniors, to women, to small businesses. This is very important legislation. So we're, again, as I say to you every time I see you, one day closer to passing historic legislation which will make progress, history of course, but progress for the American people. You see behind me an array of organizations, significant organizations who are supporting health care reform. That list grows by the moment. Since it was printed, the AFL-CIO has given its firm endorsement. The Catholic Hospital Association has endorsed the legislation. I'm pleased that we got a letter from representing 60 leaders of religious orders, sisters. I'm pleased to say the School Sisters of Notre Dame and the Sisters of Notre Dame de Namur, two sisters that taught me in my life, were on the list. But every order that you can think of was there, saying that they wanted us to pass this life-affirming legislation. So, as I say, that list goes on, and certainly with more to come. With the release yesterday of the CBO figures, now people have seen the bill, have seen the score, the list of supporters growth. And that score, let me get back to it for a moment, 32 million Americans insured, over $1.3 trillion in deficit reductions, in savings for the American people. Accountability for the insurance companies, affordability for the middle class, accessibility for many, many more people. It is all of those things, but it's also liberating legislation. It frees Americans to live their passion, reach their aspirations without being job locked because they have to have health care, especially if they have someone in their family with a pre-existing condition. So it's about jobs, 4 million new jobs created, several hundred thousand, 4 million in the life of the bill, several hundred thousand almost immediately. And it's pretty exciting for us. In 6 months of enactment, no child in America can ever be denied coverage because of a pre-existing condition. As the bill comes into effect, no longer be caps on what you can receive, but there will be caps on what you pay in. The reforms in the bill the health insurance reforms are very significant. We talk about money in the bank when we talk about the deficit savings, the more than $1.3 trillion in savings. But we have a story bank with millions of stories of American families who have suffered because of the unfair treatment they have received from insurance companies. The American people have played on the turf of the insurance companies for far too long. It is now time for them to play on the turf of the American people. Our members know that. They are committed to a healthier America, and a healthier America that is achieved also by making us more fiscally sound as we reduce the deficit, as we improve quality, expand coverage, and hold the insurance companies accountable. I'd be pleased to take any questions. Yes.
In the fall, as you know, the night before the vote, your side went to the Rules Committee. Mr. Stupak had an amendment which was made in order in the Rules Committee, and that was the order of the day on that Saturday. Will we expect to see a similar effort in the next 24 to 48 hours as abortion and the pro-life Democrats on your side of the aisle try to work something out? I've heard something about possibly doing a corrections bill. Can you illuminate us on any of that?
No, I haven't heard any of that. What I have heard is that this bill is about health care, not about abortion, that we all agree that there should be no federal funding of abortion. That is the law of the land, and that it is there should be no expansion of abortion, a woman's right, one way or another, to diminish or expand that right. So if you don't want federal funding and you want the status quo for abortion access and you want to pass a health care bill, this is it. There are members who may be talking, and I know, as you referenced, Mr. Stupak has talked about something, but that's right now we're just getting votes to pass a bill.
There are a number of members.
I'm trying to not do the same people every day, so if I look over you, it's because we have the Williamsburg rule in our caucus. If you spoke yesterday, you're probably not going to speak today.
I didn't get a chance yesterday. I'm glad.
I know.
There are a number of members from states that there were corrections to Medicare disparities in the House bill that have been taken out. Mr. DeFazio, for one, from Oregon, says that his state is getting nothing. They're being treated unfairly, and that right now he is a no unless that is corrected. Is there any fix possible in the reconciliation package for states that feel they're being shortchanged on Medicare money?
Well, without subscribing to the representation that our highly respected member of our Congress, Mr. DeFazio, made, there are significant ways to address the disparity issue in the Senate bill. But we do want the language to be closer to what we had in the House bill, because that represented a compromise between those who have a legitimate concern about the reimbursement to their states being unfair, and they are, and also aligned with that the issue of wanting quality, not quantity, of procedures, and these sort of go together, but they can be dealt with separately. And those who say, yes, but we're dealing with large populations of poor people and cultural diversity and the rest. So in any event, both sides of that discussion, which really had the same common interest, which was to have a fair reimbursement so that doctors would be available in all of the states. We're working on that language. Well, the point is that this is a big coalition. We had a meeting in my office yesterday that was, I don't know, maybe 50 members, one side or the other. But we have reached agreement before on this, and that was the language in the House bill. And I feel comfortable about where we are heading, but we're working on that.
Madam Speaker, do you have the votes? Do you have the votes, Madam Speaker?
We, as Mr. Hoyer has said, when we bring the bill to the floor, we will have a significant victory for the American people.
Madam Speaker, on the Medicare question, the so-called doctor fix, could you speak to why that was not included in this legislation?
Well, we've been including it in legislation for a long time because it's not about a doctor fix. It's about our seniors or anyone who relies upon Medicare to have access to physicians, that they be in their region and in their program. And so this is, again, you call it a doctor fix, but it's really about access to health care for Americans. It's not in this bill, but we will have it soon. And then we have made a commitment to do this. This is very important.
Doesn't it also add then to the deficit? I mean, if you save a certain billion and then you address this problem later, you go negative in the deficit when it comes to health care.
We'll see how we advance the bill. But last year when we did our budget, we had a number of issues that were not part of pay-as-you-go. They were SGR, the standard growth rate, that's what you're referencing. They were middle-class tax cuts and the AMT. And that is, that's what we are, that's what we have addressed. As we go forward, and it will be soon, we will address that because it's necessary mostly for our seniors, but anyone who has access to Medicare services.
You say that the mark isn't moved on abortion. Back to the issue of abortion. You say the mark isn't moved by this package, but we're hearing from so many undeclares that this is still an issue. Are you worried that it is going to become a last-minute issue like it did with the fall vote?
Well, we have a number of issues. We have the regional, what we call regional disparity issue. We have a couple of technical changes that we need to make, that we know we have to make. But as we go forward, we'll just have minimal changes. There will be no further changes in the bill. No further changes in the bill. Yes, sir. You were.
Madam Speaker.
That was your question. Okay. You had a question yesterday?
Madam Speaker.
Yes.
Just so I'm clear here, are you saying there won't